Hello and welcome everyone. I'm Dr. Saptarshi Banerjee, coming back to you again after a long break. I shared with you last time, if you recall, was our discussion on COVID remedies and how to tackle long COVID. I'm sure those remedies have helped you in your practice. In these series of lectures, I'm going to share with you very interesting tips on how to handle common ailments. Acidity, gastric reflux, GERD, bloating, these are very common ailments in the subcontinent as well as worldwide, I'm sure. And I'm sure over going through my videos which I've shared earlier on, I'm sure you understand that my approach is classical, practical homeopathy. What I can do, you can do as well. You can implement that in your practice as well. So in this series of lectures or in this short video, I'm going to share with you how to handle acidity, acute acidity. I'll be sharing with you in a later video about constitutional remedies or polycrest which you can handle acidity with. But these are few selected 10 lesser known remedies or medium-sized remedies which can help you in your clinical practice with handling acute acidity so that the patient is not dependent on conventional PPIs, proton pump inhibitors, or not dependent on conventional antacids. So lesser known organopathics, my friends, for acidity. Here we go. My number one in this list, my friend, is a wonderful remedy which is known as Carica Papaya. For my Western friends who are listening in, this is a remedy which is prepared from papaya popo and is available worldwide. It has been used in Ayurveda for hundreds of years with very good results. And I want you to use it with good effects as a homeopathic remedy as well. Few interesting uses of Carica Papaya: indigestion from milk and meat. That's one of the classical indications. So acute acidity, acute indigestion from milk products or meat. Secondly, it's a fantastic remedy for low appetite, especially when the system has been drugged by conventional remedies. If you think of a case in today's world when people are dependent on conventional painkillers, conventional remedies, even when they're recovering from COVID, then they've had a lot of use of conventional remedies and the appetite has gradually diminished and destroyed. And your Carica Papaya can take care of that as well. Number 3, you have Liontaria, which is stool which contains undigested matter. That is important for Carica Papaya as well. And lastly, there is a lot of liver tenderness. So when they press the abdomen, they feel it's tender, it's sensitive. So milk and meat, which causes indigestion, that's important for Carica Papaya. Secondly, as I shared with you, Liontaria, which is stool which contains undigested food particles. So there is malabsorption as well. Thirdly, milk and meat, which causes indigestion, just correcting that. Thirdly, as I shared with you, there is liver tenderness. And lastly, do also remember for Carica Papaya, you can also find low appetite, especially after drugging by conventional remedies. When the system has been totally drugged by conventional remedies, you will find there is a lot of loss of appetite. This is important for Carica Papaya. You can use it as an acute, you can use it as organopathic to overcome the conventional drugs. Tincture, if you're in the subcontinent, 10 drops in a cup of water, 8 hourly. You stop when the patient improves. Or if you're in the Western world, if tincture is not available, you can use 6C as well for Carica Papaya with very good results. And that's a very important use for prescribing Carica Papaya. My second medicine in this list is another fantastic remedy which I've used with very good results over the years as well, is eagle marmalas. Eagle marmalas is again another medicine which has been used in Ayurveda for hundreds of years and thousands of years. It is prepared from the bale fruit, and again bale is a very common article of food which is used as a stomach soother. Eagle marmalas comes very close to a polycrest. Why? You have the classical 4 to 8 p.m. aggravation in eagle marmalas. So typically like lycopodium. So cases where you have prescribed lycopodium has helped to a good extent, but you're still not being able to help the patient withdraw the conventional chemicals. Eagle marmalas can be really, really useful. 4 to 8 p.m. aggravation. Again, like lycopodium, you have the dropsy in eagle marmalas. So there is a lot of water retention, edema in eagle marmalas as well, dropsy. So it can be used in dropsical conditions, which is related with the gastric system, which is related with liver, and eagle marmalas can help you with that as well. And thirdly, in eagle marmalas, which is interesting, there is a lot of bloating and that is again lower abdomen, like lycopodium, bloating, lower abdomen. So you see two factors you have to understand, my friends. A, these organopathics can help you withdraw the conventional antacids. Patients are not seeing any light at the end of the tunnel. They're frustrated. They're so much dependent on conventional painkillers. A. B, whenever you're using these remedies, also keep in mind that you're closely relating with the polycrest. So very many times we do not like to use these new remedies, but when you try and use it in conjunction, in understanding with the polycrest, you'll be able to use these remedies better. I'm sure you're using lycopodium. Whenever your lycopodium is failing, do think of eagle marmalas with the 4 to 8 p.m. aggravation, with the dropsy, with the bloating, which is very important. And you'll also find in eagle marmalas there's a hot vertex as well. So there is a hot feeling in the head, there's a hot feeling in the vertex, which is very classical for eagle marmalas as well. Tincture, 10 drops in a cup of water, 8 hourly, whenever you feel you need to help overcome the acute acidity, or you can use it in 6C as well, 2 globules in a cup of water, 6 to 8 hourly, whenever you feel you're having acidity related symptoms. So that's important for eagle marmalas as well, which is a very useful remedy again. My third medicine, my friends, in this list is another very useful remedy, is Robinho. I'm sure many of you have used this remedy in practice, but again you have to understand the comparative metromedica here. Comparative metromedica is very important to understand between related remedies. Whenever you come across a lot of reflux, acidity, there's a lot of acid reflux. Along with that, there is a gastric headache, and that is one of the gem indications for prescribing Robinho. So a lot of reflux, sourness is very characteristic. Sour vomiting, sour stool, sour perspiration, sourness of all discharges. And along with that, you have a gastric headache, which characterizes Robinho. I'm sure you know the polycrest for sour discharges. You have that in Maccarb, you have that in Hipersal, you have that in Calcaria, Lycopodium, Bryum. But whenever you think of a small remedy which has these sour discharges, especially due to the hyperchlorohydria, which is so classical for Robinho, and that is a very good indication for prescribing Robinho. So with that reflux, you will find the gastric headache, which is very classical. But one of the very important things for Robinho, as I mentioned, is the gastric headache. But also you have to remember some of the foods which flare up for Robinho. You have aggravation from flatulent foods. So cabbages, gravies, these really flare up for Robinho. So whenever you are inquiring for acute acidity, always ask what is the thing which flares up the acidity more. For Robinho, it is cabbages, it is gravies, it is flatulent foods which flares up the acidity for Robinho. Also turnips. So many times vegetables and flatulent foods flare up the acidity for Robinho. So remember, for a gastric headache where there is a lot of sourness of the discharges, that is very classical for understanding Robinho. With the flatulent food aggravation, cabbages, gravies, turnips flare up the acidity for Robinho. That is very classical. You can use it in tincture, you can use it in 6C as well. Again, the dosage, the posology is the same. Do understand that there are few closely related remedies which comes close. Whenever you think of the gastric headache, you also have the iris versicolor. Iris vers is also another remedy which has this kind of reflux. But the difference here is in iris versicolor, there is a lot of burning. So right from the stomach it goes, right from the throat it goes down to the stomach. So there's a lot of burning. Along with that burning, you'll have a gastric headache and you have a constipation. So that is important for iris versicolor. So the difference, the comparative metromedica, in Robinho you have the sourness, in iris is more burning through the entire alimentary canal. Along with there is their headache, along with that there is constipation, which you may not have in Robinho as well. So iris versicolor is a related remedy with the gastric headache. Do also remember another very useful remedy is yucca. Yucca is a closely related remedy where you will find this kind of bilious headache. But whenever you think what is the difference between a gastric and a bilious headache, in case of bilious headache is more bitterness, so bitter vomiting which you have with yucca, whereas in case of Robinho it's more sourness because of the hyperchlorohydria. So the comparative metromedica is more with yucca, is more with iris versicolor, which is important to understand for these remedies. tincture or 6C again for Robinho. The fourth one in this list, my friends, is another very useful remedy, and I want you to use it as well, is Lobelia Inflata. In case of Lobelia Inflata, which is important to understand, is there are two factors. Either you can get a gastric headache like Robinho, but also what is interesting in Lobelia Inflata is you can get a dyspnea of gastric origin. So whenever they had a meal, whenever they are full with food, there is a lot of flatulence formation and they're out of breath. So there's shortness of breath after eating. You'll find that in Boricus Metromedica, you'll find that in Clark, who mentions there's shortness of breath after eating, which is very important for Lobelia Inflata. So either you can get a gastric headache in Lobelia, or you can get a dyspnea of gastric origin, which is important. So either a gastric headache, or you can get a dyspnea. So both are important factors for prescribing Lobelia Inflata. And also do remember, in Lobelia there is profuseness of discharges. So either you can get a profuse sweat, or you can get profuse salivation as well in Lobelia Inflata. Sometimes, with the water brush there is salivation as well, which is important for prescribing Lobelia Inflata as well. So gastric headache with dyspnea of gastric origin, that is one of the classical indications. Whenever the patient says, I need to take an antacid because I am feeling out of breath, I am feeling breathlessness, post eating, there is a fullness in the abdomen, and Lobelia Inflata will help you with very good results. Sometimes they can tell you like an empty feeling, a faint feeling at the epigastrium as well. But profuse salivation, profuse perspiration, two very good concomitants for Lobelia Inflata. Tincture in the subcontinent, even 6C, 30C works well for Lobelia Inflata. Specially adapted to obese constitutions. They're obese, they can be alcoholics, they can be addicted to tobacco as well. So those can be few factors in the background for Lobelia Inflata. But it's a very useful medicine for acute acidity to overcome the acute condition. My next one, my friends, in this list is another fantastic remedy which I've used as an acute, and that is sulphuric acid. I'm sure you have used this remedy, but I want to quote you or share with you N.M. Chaudhary's words about sulphuric acid. That he remembers the sweet old days of his childhood when he used to pluck the raw mangoes from the trees. So N.M. Chaudhary remembers the sweet old days of childhood, plucking the raw mangoes from the trees. And there he used to bite on that, and that sourness which he used to feel when he biting the raw mangoes and setting the teeth on the edge. And that's very, very classical for a remedy like sulphuric acid. Sour eructation, again sourness like Robinho, but here the sourness is more on the teeth. It sets the teeth on the edge. That is very, very classical for sulphuric acid. So whenever a patient tells you with acute acidity, with acute reflux, that there is sourness in the mouth, but it's almost like my teeth are on my edge as I've taken or have bitten on a raw, ripe fruit, and that is the classical indication for prescribing sulphuric acid. Sour eructation, setting the teeth on the edge. Along with that, in sulphuric acid, there's a lot of weakness. There's a lot of debility. Why the debility? It's an acid. So the debility is coming from the acid, and the debility here is of the digestive tract. So the entire digestive tract is very, very weak, is very debilitated. So sourness, especially with the teeth. You see how the comparative Metromedica comes here. Your Robinho will tell you sourness, sour eructation, sour vomiting. But whenever it's a sulphuric acid patient, he will tell you that it's like as a bitten a raw mango, a raw sour fruit. And that's the exact expression of sulphuric acid. Sometimes with sulphuric acid, you can find they're very long-term alcoholics. So they've been dependent on alcohol. You can get alcoholic tremors. You can get bleeding from the orifices due to excessive alcohol intake and liver damage as well. But those are long-term complications of sulphuric acid, which we'll have another session later on. But with an acute acidity, this is very important to understand with the reflux. This is classical for sulphuric acid. Again, you can use in 1X or 6C as well. Both are useful for sulphuric acid for overcoming that acute acidity. Patients are not dependent on conventional medication. You can use sulphuric acid to overcome that condition. So I shared with you for sulphuric acid, sourness sets the teeth on edge. that is very, very classical. Debility is also very, very classical for sulfuric acid. The weakness, which is exhaustion, is very prominent. And thirdly, as I shared with you, there can be alcoholics as well in sulfuric acid. So these are very important factors for prescribing a remedy like sulfuric acid. 1X, as I shared with you, or 6C are good indications.